Good afternoon, ma'am. My name is Nicola Villarino, and today I will be performing the art technique. First, assess the patient if she is capable of cooperating with you or comfortable with cooperating with you, and assess assess the client if there are presence of contractions, if the bag of water has already ruptured, and if the patient has some urgency to push, and assess the vital signs and fetal heart rate. Next po, check the room temperature if there are any air ducts. Next, prepare the materials and the air pack. Next po is introduce yourself to the patient. Good afternoon, ma'am. My name is Nicola Pellerino from BSN2D, University of St. Anthony. Next, transfer the patient to the DR room and DR table, and position the client on lithotomy and put drapes on her, and encourage the patient on bearing down technique, and wash hands, and wear the two layer gloves. Next, apply perineal support for the cephalic delivery, and catch the head with your non-dominant hand. And next, when the head is delivered, do not tell the client to not push, and deliver the shoulder slightly pushing down the head, and grasp hold the thigh of the infant with your dominant hand. The next, note the sex and time of the delivery of the baby. Next, place the baby on a clean and dry cloth towel on the mother's abdomen, and thoroughly dry the baby for at least 30 seconds. Next, perform the Apgar scoring. Place the baby on the mother's skin to promote skin-to-skin contact. And next, remove the second layer of glove, and properly discard it. And put the clothes on the baby and bonnet, assuming that I have put clothes on the baby and the bonnet. Next, palpate the umbilical cord if it has a pulse, and if there is no pulse, clamp the cord from the base at 2 centimeters with a cord clamp, assuming that this is a cord clamp, and another a Kelly clamp at least 2 to 3 inches, and using a sterile scissor, cut the cord at least 2 to 3 inches from the base of the umbilical cord. The next, check the presence of the umbilical cord if it has 2 arteries and 1 vein, or AVA. The next, administer oxytocin onto the mother through IM, and observe for any gushes of blood, the lengthening of the cord, and when the placenta is already out, examine if there are any abnormalities in the completeness of the placenta, and inspect the vaginal perineum if there are any tears or cuts, and perform perineal flushing. Remove and discard gloves. Then put onto it on a bin. Next, initiate proper latching of the baby onto the mother's breast. While the baby is breastfeeding of the mother, perform physical examinations like checking the temperature of the baby, like inserting the thermometer into the baby's anus, and next apply eye prophylaxis or erythromycin onto the baby's eyes from inner canthus to outer canthus. Then next, then administer vitamin K, BCG, and Hep B vaccine on the baby, and transfer the baby and mother to the ward while they are still on skin-to-skin contact, and place mother on a flat bed for 4 hours. Then next, check vital signs of the mother from within 1 hour. It is always Q15, and for the next 3 hours it is Q30, and also to the baby Q15 for 1 hour and Q30 for within the next 3 hours. The next, evaluate the mother if it is comfortable, if it has normal vital signs, and if there are any complications, and document the delivery of the baby and the procedures that were performed on the baby and the mother. And that is all po. Thank you.